us that we need be strangers.
Good afternoon. If I could have your attention, please continue having your lunch. And if I could ask during Kathy Stack's keynote, if we could maybe try to keep the clanging to a minimum, that'd be really terrific. Thanks so much. My name is Clay Yeager. I'm with EvidenceBased Associates and also a member of the Blueprints Policy Group, and it's my pleasure to introduce today's lunch speaker. She has a remarkable career at the Federal Office of Management and Budget, but before I talk about Kathy's background, while we're talking about OMB, just a reminder that next Monday is tax day, and for those of you who haven't gotten them ready yet, get those checks into the federal government. This year's proposed budget, for those of you who are seeking some trivia, is a little over $4 trillion. That's trillion. And just to give you a sense about what that means, the staggering amount of money that we spend in federal government, if you make $40,000 a year, it'd take you about 25 years to earn $1 million. It'd take you 25,000 years to earn $1 billion, and about 25 million years to earn that billion that you've been seeking. So those wannabe billionaire and trillionaires, I hate to tell you, but the clock is winding down. Kathy Stack joined the Laura and John Arnold Foundation after a distinguished career of public service at the Office of Management and Budget. She served the administrations of 5 presidents. She led the effort within OMB to ensure evidence of impact of government agencies as a condition of receiving government funding. What a concept. Ron Haskins, who many of you may know, he's a distinguished fellow at the prestigious Brookings Institution, a Washington, D.C. think tank, wrote this about Kathy Stack in his book published in 2014 called Show Me the Evidence. Ron said the most important staffer was Kathy Stack. Near the end of the Bush administration, she brought nurse-family partnership, and that's when we first met, in 2005. She brought NFP to the attention of other senior officials at OMB, and then expanded the use of evidence-based models under a $10 million home visiting initiative, which was enacted by Congress in 2008. She also brought the new home visiting program to the attention of the newly assembled Obama administration in 2009. And after important adaptations were made, the program that Kathy Stack designed became the blueprint for a much larger home visiting program created by the Obama administration. Kathy has a long and distinguished history of trying to get both OMB and executive branch agencies of the federal government to focus more attention on evidence and the role of rigorous evaluation, especially randomized controlled trials, when determining the effectiveness of grant-funded programs. Eventually, Kathy developed a network of career officials at OMB and other federal agencies and who wanted to pursue an evidence-based agenda. In 2013, she was appointed by the Office of Management and Budget to be its top advisor for evidence-based innovation, where she was instrumental in helping future administrations expand the evidence-based agenda. Ron Haskins, in his book describing Kathy, referred to her, and I quote, "Kathy Stack is the queen of evidence-based policy in the federal government and administration agencies." In 2015, Kathy left federal government to become vice president of evidence-based innovation at the Laura and John Arnold Foundation, whose core mission is to address the nation's most pressing and persistent challenges using evidence-based approaches and creating functional solutions that target the root causes, not just the symptoms. The foundation, which we'll hear more about this afternoon, incentivizes bold and creative thinking. The foundation made a wise choice in selecting Kathy Stack for this important role, and so please join me in welcoming the queen of evidence-based policymaking, Kathy Stack.
Hi. So I would never have called myself the queen, but it was quite an honor to have somebody else characterize me that way. So you heard from Gary Van Landingham this morning, and so Gary and I are kindred spirits. When I was in government and he was at Pew, we strategized on a lot of different things and how to make our efforts come together in a more meaningful way. If I were describing what distinguishes Gary from the work that I am focused on now and did a lot of work inside government, I think of Gary as really creating systematic structure around how to enable decision makers to use existing evidence, understand it, sift through it. And my focus tends to be on how do we build new evidence? Because there's huge pockets where we really just don't have enough. And so how do we organize ourselves to do that? But together, both the using existing evidence and building new evidence is what I think of as building an evidence infrastructure, which is why I need my slides. Here we go. So first, do I have I don't have a thing. Can I tell you this? Oh, here it is. I got it. Let me just briefly describe what I consider the fundamentals of an evidence infrastructure. First, focusing on outcomes and impact. We've got lots of programs now that are trying to measure outcomes, but it's not sufficient. We really have to understand what difference is being made by an intervention using some sort of legitimate control group, ideally through a randomized control trial. Second, you can only build this infrastructure if it's co-created. Co-created by people who are policymakers, people running programs, and the practitioners, research experts, data experts, coming together to say, how do we focus on things that are relevant and feasible in the context of where we're trying to implement them, but using rigorous methods to understand what works. Third, apply existing evidence of what works so that everybody who's making a decision, regardless of whether you're at the top of the food chain or down on the ground, you have some understanding of what the evidence tells you is likely to work in your context. Fourth, build new evidence, but do it using rigorous evaluation, which is going to enable you to have more confidence that that really is the driver of the change. And lastly, optimize the use of high-quality data. There are many data sources that are collected by one set of programs that could be tapped by other programs if we get creative about how to do that. Building blocks. So I think over the last 10 years, we've made a lot of progress in putting together building blocks that the next administration and the incoming Congress can work from. And I want everybody to know that the spark that put a lot of this in place was a meeting that I had with David Olds and Clay Yeager back in 2006 when David came in to meet with White House policy officials, and there was a scheduling snafu, and they were not available. So I got a call asking if the career staff in the Office of Management and Budget could host the meeting. And David came over, and we were expecting it to be one of these meet and greets where organizations come in and they trot out their charts and they talk about how many people they serve and they tell the Timmy stories that you heard about this morning. And instead, David gave a presentation about the results of the randomized control trials in nurse-family partnership. And we all sort of sat back in our chairs and said, what's wrong with this picture? If there's such strong evidence that this model works, why is it that there's so much money that flows to state and local governments in flexible programs that are available to support programs like this that aren't going to NFP? They're going to other projects that have far less evidence of effectiveness. And so we diagnosed the problem for about an hour or so and concluded a couple things that were very systemic. One was the lack of authoritative understandable information that state and local decision makers could use to guide their decisions. And second, the lack of financial incentives, that we put lots of money out in federal programs like the Maternal and Child Health Block Grant, TANF, SSBG. And there's not a carrot there that says you need to use these dollars for programs that work. So based on that, we had a little bit of discretion as career staff in OMB to come up with big ideas, and we came up with our $10 million initiative that was the first home visiting initiative in President Bush's 2008 budget. It got passed by Congress, and as Clay mentioned, it became the blueprint for the $400 million initiative that we have today. What was different about home visiting is that there was a couple of decades of research that had been done. There was fairly rich evidence, not just for the NFP model, but for some others. But the vast majority of programs in government don't have that rich evidence. And so in the Obama administration, we thought about how can we create an incentive structure and a design of programs where we tackle two problems. One, we get applicants and grantees to say, what's the existing evidence base that I ought to be aware of to inform my strategy? And second, how do we build more rigorous evidence going forward so that we can test things in our own context, in our own sites, but also see if it's relevant to other sites? And that is essentially, those are the principles that guided the Investing in Innovation program at the Department of Education, which is a three-tier model that's now taken hold in other agencies, Department of Labor, Corporation for National Community Service, for example. But in that model, you've got a scale-up tier, large grants for the models that have the strongest evidence, a middle tier of middle-sized grants for promising evidence, and a bottom tier for proof of concept, where you've got these new homegrown, untested ideas that may work. They may be blockbusters, but we'll never know unless we subject them to rigorous evaluation. So in every single one of these tiers in these programs, we expect that the grantees participate in rigorous evaluations that could move them up to a higher tier. So there's also a number of other program models that I'm sure you've heard of that developed over the last few years. Pay for Success, social impact bonds. That was just an abstract concept in 2011. Now we have 36 states that are in active planning of SIBs, social impact bonds, or actually implementing them. We also have performance partnerships for disconnected youth. I'm hoping that some of you are participating in one of those. These are pilots that are now allowed by Congress that enable states and local communities to blend youth-serving funds from federal funding streams if they can, and they can get waivers from program requirements. But they have to have a strong outcome-focused strategy and use data and evaluation. So clearinghouses and common evidence standards. Gary talked about this today, so I'm not going to dwell on it, but in addition to clearinghouses, we have a number of federal agencies that are working together to develop a common evidence framework so that we're all speaking the same language. Harnessing administrative data. This is my new passion. I think there's a growing recognition that there's these very high-value data sets with validated, authoritative data that are underutilized. They're behind lock and key. Employment data, earnings data, healthcare, claims and clinical information, crime records, public assistance programs, who are the beneficiaries. If we can get our hands on those data, we can answer all kinds of questions at significantly lower cost. For the most part, programs are unable to access those data. Researchers have had some success in being able to go through a process of getting MOUs and accessing the data for long-term studies, but it takes years. I mean, it's often literally years to get all the MOUs worked out, very cumbersome and slow. But we know if we can break through that and re-engineer that process, we can do amazing things. John Barron, who is now my co-vice president in the DC office at the Arnold Foundation, has developed an inventory of rigorous gold standard RCTs that have been done for less than $300,000. Raj Chetty, who's now at Stanford, has done some amazing research with tax data, taking prior RCTs and looking at long-term effects of what happens to people with the IRS data. Dennis Culhane, who I think you probably know of, is also an Arnold grantee now. He's working very hard to develop standardized processes and templates that would allow many more communities and states to integrate data across systems so that that's a tool in their toolkit. And a very cool thing is happening at the federal level. So this is with census. Census, you may think of, oh, that statistical agency that comes around every 10 years. But Census has a remarkable array of data, and they are bringing more data in every day. A couple of years ago, they got a mandate from the Office of Management and Budget to re-engineer their internal data infrastructure so that it can support program evaluation across the federal government. So they are in the process of working with other federal agencies, identifying high-value data sets that if they came into a clearinghouse managed by Census, it would enable researchers to essentially have a one-stop shop where they can come in, link their data to lots of other data. So what data is there? LEHD. LEHD is another way of saying the unemployment insurance wage and employer data from 50 states. SNAP, they have 10 states that have now provided their SNAP data, with more coming in. The decennial census data, address data, and they can also link to crime statistics. So one of the things that we are working with now with Census and an intermediary organization who sits outside government, and I hope that it could open up lots of opportunities for folks in this room. We're planning a pilot where an outside data broker positions themselves to set up standardized data sharing agreements with Census, but that then allows state and local governments or networks of nonprofits to feed participant data in through this data broker and link it to national data sets. So for instance, performance partnership pilots, where pilot sites are expected to measure employment and educational outcomes. This can be a way of getting access to employment data for people who move across state lines, as well as educational data through the National Student Clearinghouse. Policy labs. This is a term we use in the Arnold Foundation to describe research practice partnerships, where research institutions are working hand in hand with government to say to the government, you tell us what your challenges are, what your problems are, and we will bring our faculty and our best students to the table to construct evaluations to help you do that. And lastly, philanthropy. The progress we've made over the last 10 years couldn't have happened without foundations at the table, imagining what the world should look like and providing seed money to do things that government never could. So Gary mentioned a few of these, but Congress is providing some new opportunities to move more deeply into evidence-based policy. First, the Workforce Innovation and Opportunity Act that was passed in 2014 puts much greater emphasis on integration of data and reporting systems and strengthens the focus on evaluation. The Every Student Succeeds Act, which was just passed in December, devolves responsibility to states and local governments for educational decision-making, but it asks them to use evidence to guide their decisions. And it provides incentives for evaluation. And last, the commission. So the Evidence-Based Policy Commission, you might say, it's just a commission. They just issue reports, it sits on a shelf. But I think there's a lot of us who think that this one has tons of potential. So first of all, it was championed by Paul Ryan in the House, who found a co-sponsor in the Senate, Patty Murray. The commission has to report out in 15 months, and it's charged with looking at what are the optimal arrangements that allow for linkage of all this high-value data in ways that enable researchers to get access to it so we can dramatically increase the rate at which we are producing high-quality studies. They also have to look at how to do this while protecting privacy. And assuming that they can do that, then they go the next step of looking at program design, how to incorporate outcome measurement, rigorous impact evaluations, RCTs, into the basic DNA of government programs. So now I'm going to have fun. I'm not on the commission, but I get to think about what the commission could do in terms of a vision and how their recommendations could potentially transform how we run government programs by going at that core question of data infrastructure and what can happen if we change that data infrastructure. So first, we have time. They obviously need to modernize the government's capacity to manage and exchange data while protecting privacy. So it's absolutely critical they get the nuts and bolts right, but that can be done through re-engineering the processes that data flows. There are many, many cases now where we've created secure data enclaves, where researchers sit inside the enclaves, and others who need answers to questions push their data in where it can be analyzed in a secure way with the findings coming out. There's also cutting-edge technology that's been developed in the financial industry and the national security industry that we haven't begun to tap in social services that allow for very creative ways of linking data and getting answers that will not violate privacy. Second, we need to design a data infrastructure that will answer the important questions that are important to state and local government, not just the federal government. So one phrase that's missing completely from the commission legislation is state and local government. But at the same time, the federal government sends about $800 billion a year in grants out to state and local governments. So there's no way to create an infrastructure that's going to improve program effectiveness and evidence-based policy if state and local governments aren't at the table. So we've got to think about that. How to enable state and local governments to say, here's the questions that we're trying to answer, and how do we get access to the data we need to do that? Next, collaborate with philanthropy on compelling use cases and prototypes. Philanthropy can go race ahead of where government can go. Government moves incrementally, and it can't just wipe the slate clean and start over. Philanthropy can think about how to create prototypes outside the system that work with government and demonstrate a better way of doing business. So just to share an example, in addition to that one I talked about that might enable youth programs to access employment and education data, the Sloan Foundation is working with the Arnold Foundation and a few other funders. We've issued a solicitation that is asking research institutions whether they want to be designated as administrative data research facilities. And if they sign up for this, they're signing up to be the first wave of exemplars on how to standardize the approach to data sharing across a whole range of sectors: healthcare, economic data, consumer lending data, tax data, healthcare data. And this process that we're setting up as what we're calling ADR facilities will work in collaboration with census and the federal government so that the processes that it gets established outside government for sharing data mirror the processes that the government is setting up. Use cases. I think there's an opportunity with these prototypes to think about what are the amazing use cases that would help people at every level of government make better decisions. So, problem identification, being able to link data sets, for example, to identify high utilizers of various systems that could be the targets for future interventions. Performance management. You think about all the performance management activities that are going on in government where people are chasing data that's not really particularly reliable. When now we have a way of creating provider scorecards and snapshots of performance on a recurring basis using these high-value data sets. Low-cost RCTs, we've talked about that already. We can do a lot more of them with this infrastructure. And long-term follow-up studies. So I'm going to pick on David Olds again. We have an opportunity to think about, what happens to the people who participated in those early trials of NFP. Where are they 5, 10, 15, 20, 25 years later in terms of a range of outcomes that can be measured through this linked data? We also have the opportunity to think about how to improve performance measures and our understanding of near-term practices and indicators that lead to long-term outcomes. Because we can look at those outcomes, match them up with what happened to people at an earlier point in their life, and figure out where's that sweet spot. So once we've done all that, it doesn't do any good unless you can actually reimagine how you would employ those new tools to redesign how we run government processes. So I'm going to suggest what our new program should look like in the future. So first, we should be holding programs accountable for outcomes and near-term indicators that correlate with those outcomes, but scaling back significantly on all of the compliance reporting that we are saddling people with so that they can demonstrate that they are accountable for results. Second, we can be requiring grantees to measure multiple outcomes. There's no reason why an education program that's focused on high school students should just look at graduation rates. They can be looking at college enrollment, college graduation, and employment. Criminal justice programs can be looking at mental health data. Health programs can be looking at health outcomes and cost data so that we can really get a much richer understanding of what are the things that you can do that can satisfy multiple needs. Another benefit of that is that it breaks down the silos. Everybody's frustrated by that, but if you require your grantees to measure multiple outcomes, they're going to go find those partners. They might even find the libraries, right? You've talked about the libraries and the role that the libraries can play, because there's lots of delivery partners who can help achieve those multiple outcomes. Third, we can start changing our expectations for what grantees do. Right now, there are many people who are under the impression that evaluation and data analysis is not a program activity. That gets done somewhere else. That's nuts. We should be making it a core expectation that if you're going to take federal money or state or local money from a government to do an activity, that you are analyzing data, conducting evaluations, participating in evaluations, and totally committed to learning. And in fact, that is a very, very allowable activity that you should use your dollars for. So last, if you do all those things, you've created the ability to have sustainable funding models for learning and improvement that don't rely on philanthropy to say, oh, here's some money for you to do an evaluation. if programs have to perform, if they have to show how they're learning, they're going to go find those research experts who can help them do that. And if government sets standards, like the blueprints ones, for what constitutes a rigorous evaluation, they'll find high-quality researchers. So last, you got to engage the new team. There's this opportunity coming up, new election, new White House, new Congress, new changes in state and local government. And they have to be brought along. We need a roadmap for how you move from where we are now to this new world. You can't do it all at once, but if there's a strategic, coordinated approach to pilots that essentially can be the beacons for other programs to follow on, to show how you make all these tools work together, we can get somewhere. So that was my letter to the Evidence-Based Policy Commission, but now grounding it in reality and where we are. One thing that I have learned over the years is that the only way you make progress in this world is to recognize that most of the things that turn people in this room on, the wonky stuff, gets you nowhere when you are trying to convince a decision maker to get excited about this stuff. So we've got to create the stories, the anecdotes, but not the Timmy stories, okay? These have to be the anecdotes about how taking this approach can transform how government works and actually demonstrate that it moves the needle. Stories about how partnerships form of researchers and practitioners who start solving problems together and discover that it's not just one problem that they're going to solve, that they're going to continue to have that relationship and make this a continuous process. It's those stories that can make it cool. And I think we all have to kind of recognize we are in this collective effort to make it cool. And so that's my charge to everyone, make it cool. Thanks. If anybody has any questions, we probably have a few minutes, not too many, but any thoughts?
Can you say something more about use the example of how there's data that shows a connection between SNAP and crime? Did you say something about that, or did I just hear it the wrong way?
I didn't necessarily say SNAP, but I think you have an opportunity, in doing this kind of data analysis, you could be linking all kinds of data sets on the front end to look at correlations so that you could see, who are the kinds of individuals and families that are most likely to be involved in crime, and what are other characteristics? Are they on public assistance? Are they in college? Where are they living? Are they employed? I mean, some of that is intuitive, you're always going to know it, but I think you have the capacity to develop profiles and risk categories that help you target your interventions more effectively.
Yes, thank you very much for your presentation. Just a quick question. You mentioned these different tiers, investing in these different tiers of programs, grassroots programs, developing programs, emerging programs, et cetera. Considering funding constraints, what would be some of your recommendations in terms of being able to get rigorous analysis into the hands of these organizations and these programs so that they can move up the tier?
So let me give you an example. When the Department of Education launched the Investing in Innovation program back in 2009, 2010, they also had something that was on the research side of the house called the What Works Clearinghouse. What Works Clearinghouse was premised on a lot of the same principles that blueprints of let's tell people what the synthesis of research suggests are the strategies that work most effectively, meeting these high standards. Well, it wasn't getting a lot of traffic, but after the Investing in Innovation program said, if you want our money, you need to demonstrate that you've looked at the research, to see what's relevant to the particular problem that you're trying to tackle, suddenly the hit rate on the What Works Clearinghouse went way up. And I think it is actually not that hard to create an expectation if you've got funding you can dangle out in front of people, that people try to understand the research on the front end, and that comes by pointing them to the clearinghouses, also helping them find translators and researchers who can help them make sense of that information. But there are going to be a lot of cases where there isn't a lot of research available, but knowing that is at least a starting point and tell you, okay, we don't know a lot, so we're going to start down on this low level, and we know what standards we have to meet when we do evaluations, so we can move up those tiers. Is that it? I think that's it.
Hi. I am back this way to your left.
To my
Back here by the sound booth.
Oh, there you are.
Hi.
Hi.
So I actually work for the Government Performance Lab that you helped to make my job possible. So thanks to the Laura and John Arnold Foundation. And I'm curious about, you talked a little bit about the balance between compliance data and outcomes data. And I think that's something that I'm really struggling with in working with state government, because I think there's the pressure from the feds to do things like meet your Medicaid audits so that you can get your drawdowns and keep your coffers as full as you need them to be able to fund programs, and a lot of that is compliance data. But we're really trying really, really hard to get people to look at outcomes data more, but so I'm just curious, how are you thinking about the tension between those two things, and what role do you think states have at pushing back to the federal government, and what role do you think the federal government has at pushing policy down to states that takes the heat off of that a little bit?
Right. So in order to move to this more outcome-based accountability system, you got to replace it with something. You can't just, say we're going to stop doing it the old way. One thing that we did when I was at OMB about 2.5 years ago is the grant circulars, the policies that govern the accountability and the reporting processes for all federal grant programs. They were being revised. And we took the opportunity to put a provision in that allowed for waivers. And it essentially said that federal agencies can waive reporting requirements and develop new approaches to accountability and performance reporting if they come to OMB and are able to say, here is the alternative approach that we're going to use on a pilot basis. That's sitting there waiting to happen. One place that it's going to be used is the performance partnership pilots for disconnected youth. But there are many other opportunities where it could be used. I think it's got to be a ground up. I think it's got to be organizations like yours, the Government Performance Lab, that are in the states who can demonstrate that the way and the processes that are in place now are in some way detrimental, even if it's because they're chewing up so many resources. And that there's an alternative that could be tested, at least on a pilot basis, to see whether it's satisfied the auditors as well as the researchers and the folks trying to drive better performance.
Hello? Hi. I wonder if you could give an example of a term you used that I don't understand. You said that philanthropies could use use case. I don't understand what a use case is.
All right. So I tried to give a few examples, but I'll try again. So think about all the grants that go out where the federal government tells grantees, it's your job to report on outcomes. So we expect you to track your participants and tell us whether or not they graduated from high school, they went to college, they got a job, whatever it may be. That is a tremendous burden on the grantees. Many of them don't have access to that information, so they either don't provide it, or they provide incomplete information, or they make it up. But it's the standard way of doing business. a use case, an example use case would say, let's transform how we do performance measurement. Let's have grantees collect identifiers, provide identifiers in a secure way to a data broker who can bounce the data off the K-12 student state longitudinal data systems, the National Student Clearinghouse to tell us about college outcomes, and the census LEHD data to tell us if people are employed or not. It's lower cost, lower burden, more reliable data. But what I've experienced being in government is that people are so head down on meeting the requirements and understanding the limitations of the system today that they have a hard time imagining how that new approach could work. So with philanthropy, if we can actually not only imagine it, but do prototypes to create it in ways that could be scaled up to support grantees across the whole government.
Okay. I think, excuse me. So this morning, I think we have heard two great visions of the future of evidence-based programming and the possibility of really remaking government, remaking the shape of the whole service provision that we provide for families and children in this country. And it's an exciting vision. So I hope that you're buying into that, and I encourage you again to keep asking good questions. I thought both times this morning we had good questions coming from the audience, and I encourage you to continue posing those kinds of questions to our speakers and to those who are presenting in the breakout sessions. So thank you very much, and we're adjourned here, and we're ready to start afternoon sessions. Thank you very much.
Every time she smiles, and when I come to her, that's just where I belong. Yet I'm running to her like a river song. She give me love, love, love.